Hello everyone, you're watching PhysioClassroom channel, and in this third video of the CIMT series, we are going to learn in detail about the CIMT screening pathway. Now, in order to ensure the success of the CIMT training program, it is very important that the therapist must have the knowledge of how to select the right candidate for the CIMT training. So let's start this video by first understanding the important selection criteria and tests that are performed on the potential stroke and other neurological patients before getting them enrolled for CIMT training. Evidences obtained from researchers have suggested that CIMT works best in those patients who demonstrate learned non-use. That is, such patients have some movement recovery in the weaker upper limb, but still the weaker side is not being used functionally for carrying out the daily activities. Now, CIMT guidelines recommend that on formal assessment by the physiotherapist, the stroke or other neurological patients must demonstrate at least 10 degrees of wrist extension, 10 degrees of finger extension movements, and 10 degrees of thumb abduction or extension movements. Now, this criteria can be easily remembered as rule of 10. That is, the patient must demonstrate 10 degrees at wrist, 10 degrees at finger, and 10 degrees at thumb extension movements. Now, this has been set as the minimum motor recovery that must be present in a patient in order to successfully enroll him or her into the CIMT training program. Now, it is important that the physiotherapy students must understand here that why these three movements have been chosen. Now, the presence of intact wrist extension, finger extension, and thumb extension movements indicates the preservance of the corticospinal tract, which is responsible for performing the fine dexterous movements by the hand, and therefore such patients have high potential to improve their upper limb functions and use them for daily activities. Another important thing to be remembered is that this criteria of 10-degree extension at wrist, finger, and thumb does not mean that wrist should extend beyond neutral 10 degrees. Now, even if the patient can extend the wrist from the maximally flexed position, extend the fingers from the maximally flexed position, and abduct or extend the thumb from the neutral or adducted position, then also such patients should be selected for the CIMT training program. Another important thing regarding the selection is that there are patients or group of patients that are categorized into the low performance group. That is, they have some movements of extension in the wrist, finger, and thumb, but they are less than 10 degrees. For such patients, CIMT recommends that the therapist should perform the Flanion test or the tissue pull test. Now, Flanion simply means a soft woolen cloth. In order to perform the Flanion test, the therapist asks the patient to grab a soft woolen cloth with whatever grip that is available to them, and then after picking up the cloth, release it back again. Any patient who is successfully able to grasp and release the flannel can be selected for the CIMT training program. An alternative test, that is the tissue pull test, works equally well. In this, a tissue that is ready to be grabbed out of the tissue box is placed in front of the patient, and again the patient is asked to grab and pick the tissue and then release it back again. Now, it is also important to note that during the performance of the flannel or the tissue pull test, the therapist should allow the patient to make several attempts in order to grasp and release the cloth or the tissue. Now, this is so because, in fact, the patient might not have tried picking up and releasing objects for a considerable amount of time. Now, even after making several attempts, if a patient fails to successfully grasp and release the cloth or the tissue, then such patients are excluded from the CIMT training program, because CIMT is not going to help such type of individuals. So, if we summarize the selection criteria for CIMT, the therapist must know three important things. Number one, the patient must demonstrate learned non-use. That is, there is a significant discrepancy between the movement recovery and functional usage of the weaker side. Number two, the minimum motor recovery should meet the standard criteria: 10 degrees of wrist extension, 10 degrees of finger extension, and 10 degrees of thumb extension or abduction movement. Or at least the patient must pass the tissue pull test or the Flannan test. Now similarly, the therapist must also be aware of the important exclusion criteria for the CIMT training program. Now, not only those patients who demonstrate poor movement recovery are excluded from the CIMT training, but also those patients who demonstrate excessive fatigability, excessive pain on movements on the paralytic side, bilateral weakness of the upper limb, or are medically unstable, demonstrate mood, behavioral disorders, and cognitive issues are also excluded from the CIMT training program. Now, it is also important to note that this desire to improve the functional usage of the weaker side upper limb must come from inside the patient, and therefore CIMT also does not work well in those patients who are not highly motivated. Also, previously, one more exclusion criteria for getting enrolled into CIMT training program was immediate post-stroke period. That is, those patients who were less than 2 weeks post-stroke were excluded from getting enrolled into the CIMT training program. But now, in the recent clinical guidelines for stroke rehabilitation prepared in 2016 by ISWP, have recommended that even post-stroke patients immediately after stroke can also get enrolled into the CIMT training program, provided they are medically stable and are cleared from the neurologist side. So I sincerely hope that the information shared in this video is going to help the physiotherapy students as well as the young practitioners to successfully screen and select the right stroke and other neurological patients to help them in improving their upper limb motor functions by enrolling them into the CIMT training program. In our upcoming videos, we will be discussing each and every component of CIMT training in detail. So don't forget to share our Physio Classroom videos with your contacts. See you all soon. Keep learning, keep sharing, and stay connected.